Welcome to Smut, did you say? Hosted by Nurse Nikki in association with Queerlana. Before we begin, please note that the views and opinions expressed are those of the host and guests and not necessarily Queerlana as a whole. This podcast is for educational and resource purposes only. It is not intended as medical advice, legal advice, or a substitute for professional care. Because of the nature of healthcare work, we may discuss heavy or sensitive topics, including mental health struggles, suicide, sexual assault, death, or violence. Listener discretion is advised, and this podcast is recommended for adult audiences age 18 and older. If you are in crisis or need immediate support, please reach out to a qualified professional or call your local emergency number. Okay, on to Nurse Nikki.
All right. Girls and gays, thadies and gentledoms, it's time to answer Smut Did You Say, where we'll expose ourselves to uncomfortable truths, plow into some pillow talk, and get those burning questions looked at. I'm Nurse Nikki, she, her. Today's guest is Dr. Lisa Wolf. Please introduce yourself and tell us Smut we're talking about.
Sure. Hi. So I'm Lisa Wolf, and I use she, her pronouns, and I am a nurse scientist who's emergency department based. I work with the Emergency Nurses Association. I'm also an associate professor of nursing at UMass Amherst. So I live in the great state of Massachusetts, and now I will never leave.
Right. You're like, I'm not going anywhere.
Not going anywhere,
Yeah.
unless it's Europe, right? So
Right. Yes.
I live in a part of Massachusetts that is I live in sort of the Amherst, Northampton area, which is a big college town, but also, like, Western Mass is actually kind of purple, like, a
Mhm.
lot of red, but this area is very, very blue and very progressive, and so my kids have had the opportunity to grow up in a space where it's like gender fluidity is fine and normal and
Yeah.
expected. So it always kind of, I guess it's weird for me to hear about places where there's like this rigid binary, although I know it exists, right? Like,
Yeah.
but having seen how like happy and um I want to say, like, engaged with their lives my kids are as they've been able to sort of explore that non-binary
Yeah.
existence. My youngest kid is trans. She is a fantastically amusing, brilliant, amazing young woman who's really like doing her thing. So that's
Yeah.
been fantastic to watch that whole process. So I think, I have both personal and research experience around LGBTQIA issues. And I think that the primary focus of emergency department research into this is sort of what are the reasons that people come into the emergency department? Does their gender identity or kind of like transition status have anything to do with why they're there? What kinds of questions are best asked of all people, right? So we want
Yeah.
to affirm people's identity. So, like, when I was in
'Cause we're
nursing
not
school,
profiling people. We can't just be like,
right,
"Oh, you look like you might be trans, so I'm gonna ask you." We need to ask
right,
everybody and make it a
you have
standard.
to ask everybody.
Yeah, I mean, like,
Right,
you can call me Nicole, but I go by Nikki,
right,
and so that's in my medical chart, and my medical people call me Nikki. But
right,
I you shouldn't have to explain who you are to be called what you asked to be called. Like, you
right,
shouldn't have to explain, like, why or, like, how that works in your head or anything. It's just like, "Hey, this is what I go by, and please respect that." And then you do or you don't, and if you don't, I don't understand what's wrong with you, and why are you in healthcare?
right. Well, I
So
would also gently suggest we use the example of Senator Cruz from Texas,
yeah.
whose given
Right.
name is Eduardo and goes by Ted. And if anybody called him Eduardo, he would, like, lose his shit. So because his preferred name is Ted. So everybody calls him Ted,
Yeah.
right?
Oh, he
I
doesn't
learned
wanna
in
be
nursing
deported.
school.
Call them
Right,
Eduardo, you deport him.
right. I learned in nursing school that you do not call, Black women by their first name, ever. They are always Ms. or Mrs. until they tell you otherwise, right? So I just do that with everybody. I don't
Yeah.
use people's first names unless they
Right.
ask me to.
Right.
Which is a little different 30 years ago, but now that I'm older than the people I would never call by their first names, I still wouldn't
Yeah.
call another adult by their first name unless they
Yeah.
gave me permission to do that because that is respectful. And I think carrying that into every encounter with a person in the emergency department by asking them their name, what do you like to be called? Because it may have nothing to do with what their name is, right? Like there's people all across the South who go by names like Gator, you know,
Yeah.
or his name is something totally different, right?
Yeah.
Um, uh, and so, like those and just being respectful, the minute you call somebody by the name they wanna be called by, like, everything ratchets down, right?
Right.
Like,
And
people's
that's what I keep
anxiety
telling
comes down.
people in the emergency setting. They're like, "Well, we don't have time for that. It's emergencies. Like, we don't
Of
care
course you have
about, like,
time for
your
that.
gender identity." But, like, how many of the things that we see are true emergencies versus, like, the people that are, like, walkie-talkie and having, like,
Sure.
stomach pain or back pain or, sciatica, whatever.
Right, you're not coding
And
someone and asking them their pronouns, right? But the
no, but, like,
85%
be
of people
realistic.
we
Yeah.
see. Right,
If you're triaging somebody and they're talking to you, just ask them. And if they're, like, desatting in front of you and turning blue, like, don't delay their care to ask them their pronouns, but, like, use your nursing judgment, right?
right,
So,
right, and I think people who object to those kinds of questions, um,
we'll come up with anything,
they'll come up with
literally.
any right? Like we talked a little bit about before. People are just jumping for reasons to be terrible, and
Yeah.
I think where that becomes really upsetting to me is that nursing is an ethical enterprise, and
Right.
Provision One. I refer all my nursing friends to the ANA Code of Ethics and Provision One, which ensures respect for all persons.
And they
So
updated it in 2025 as
I
well.
know I love it.
So, yeah.
It's actually
So,
really good.
I started to mention that to my managers when I was advocating for, being able to ask people their pronouns when I was told I couldn't. And, they said, "Well, you're not a nurse, you're a case manager." I said, "Well, my title, my job that I
You
applied
are
for
held
and
to the
got
ethical
is
obligations of an
case
RN.
manager RN, and as soon as I do something unethical, I will be a nurse because they will be coming for my license."
Right.
So,
100%.
because
And that's,
I'm
it's
held to that standard no matter what my title is.
exactly right. And it's not just individual nurses, it is uh, institutions and
Yeah,
organizations.
yeah,
So provision, I don't know, 6, I think. I got to go back and look it up, but there's a provision that speaks very clearly to the institutional obligation
mhm,
to provide a safe environment. And that includes not just physical, but psychological safety, right?
and
So,
for employees and for patients.
exactly right.
So
And so there's a large gap in the understanding of institutions insofar as their ethical obligations stand. Um, there's a big gap there between what they know and what they're doing. If
mhm,
they don't know, I would just walk around. Hello, kitty. I would. I'm about myself to print out
yeah.
like a dozen copies of the Code of
Oh,
Ethics
yeah, I do that
and
too. I'll
stick
be
them up.
like I came into the meeting that we had with things written down on paper and, like, the discrimination policy and stuff like that, and they were like, "Oh, we don't like, we get to choose our own, like, policies and what we follow," and I was like, "Show me the policy that says case management nurses cannot ask people their pronouns and can't update things in the chart despite what the training says. Show me that." And
Hmm.
they were like, "Oh, well, I'll have to look." I'm like, "Mhm, I'm sure you
Mhm.
will." And so
Well,
I
until you
looked.
find it, I'm
Yeah,
just gonna keep doing the thing that I've been trained to do. Yeah.
yeah,
So from a research perspective, understanding, like framing there's a couple ways that you can frame the problem. One is, are, some of the research questions that you can ask are like, what are the needs
mhm,
of patients in these
yeah,
populations, right?
right.
Are they honestly, are they any different than the general need of any patient who comes into the emergency department for respect and dignity, right? I would argue
Maslow's hierarchy of needs, the
safety.
second thing is identity.
Yep.
Safety, like just
Safety.
existing is at the bottom, and then the second thing is identity, like
Yep.
respect my identity.
Right. Exactly. So what we're really doing when we ignore that need is we're saying we don't really care about patient safety.
Mhm.
bottom line, right?
Because psychological safety is just as important.
Right,
And
because
I wrote
people don't here's the thing, especially in emergency departments, that's critically important to remember. Emergency nurses have to be really good at establishing a therapeutic rapport, right?
oh,
Like, we talk about
100%.
this in nursing school, whatever.
They're not gonna do anything you want them to if you don't have a rapport.
If people don't trust you, they won't tell you the important things that you need to know. They
Mhm.
will not do the things perhaps that you need them to do because they don't trust you.
Right.
And so you're just shooting yourself in the foot uh, as a nurse. And the thing is, like, I think that my perspective and also the code of ethics is a very deontological enterprise, right? It is very process focused.
Yeah.
And institutions often use a utilitarian perspective, which is outcomes focused. So no, so
Mhm.
that means
Yeah.
like no harm, no foul. And
Mhm.
if you're
You're doing
thinking
harm,
about
though.
you are
You're
doing
doing
harm,
harm.
but it's not harm that they want to measure, right?
Mhm. Yeah.
Um, but I would agree with you that harm is being caused, but they don't see it as harm. They just see it as like, well, nobody died. I'm not being sued. There's, so
Yeah.
I'm not going to worry about it.
And people don't
Um,
follow up on what we tell them to do all the time. So the fact that our attitudes and disrespect towards their identity makes them not follow up on their care or not come in when they're having a problem until it's dire because they're
right. They
so
avoid
done
healthcare.
with yeah, they're so done with healthcare. They don't wanna go in and have a problem and just be like, misgendered all the time. It'd be
Right.
like it'd be like somebody came in my room and was like, "Hey, Sarah, can you blah, blah, blah?" I'd be like, "My name's not Sarah, it's Nikki." And they're like, "Ah, I don't care. I'm gonna call you
Yeah.
Sarah."
Whatever.
You know?
Right.
Yeah,
You look like a Sarah to me.
"You look like a Sarah, that's what I'm gonna call you." And I would
Right.
just be like, "You do you even know what's going on with me? Like, do you even know, like, what you need to be doing? Are you in the right room?" Like,
Right. So
it seeds a lot of
right. So
doubt.
some of so the research the role of research here is to show the relationship between those two things,
Yeah,
right?
yeah,
So the question is there a relationship between the patient outcome, right, in terms of follow-up
yeah.
and how people are addressed in the
And
emergency
there
department, right?
there are papers about that. I've
Sure.
referenced papers about that. There's at least 2 that I know of from the US within the last couple of years. When I'm doing papers, I try to do it between, like, 24 and 25, because if you go before that, then he wasn't president. So, like, things weren't really happening. But there's a lot
Mhm.
that's come out since things have been changing in the government about, wow, this is bad. Like these are people are having a really hard time. And there's been a lot more stuff coming out about it, not necessarily like research papers, but like, just articles about how people
Right.
are struggling because of it. And the Kaiser Family Foundation has like, updates about like how the executive orders are affecting things.
Right.
And then if you look at the Trevor Project's done like an updated
Mhm.
like suicidal ideation trend and just like tracking how much just hearing this, like, rhetoric all the time, and now trans people are all gonna be mass shooters because one
I know, that's
person
hilarious. If you're gonna ban people who do mass shootings, like, you should ban white men under the age
all
of
the white
30.
men yeah, bye,
All white men don't
okay.
nobody gets a gun.
No, nobody, but now, I mean, like, North Carolina just ended, you can just walk into a store and be like, "Can I have a gun?"
Sure.
And you show your driver's license, and then you have a gun.
Right. So
So
there's a lot of stuff going on,
yeah, a lot.
and sometimes it's really hard to separate out the confounding variables, right? Because
Mm,
all of it is terrible.
yeah,
But I think right now from a research perspective, what what we really have is an opportunity because there's a huge natural experiment that's
mhm,
starting, right?
yeah,
So you've got a coalition of Northeast states and you've got a coalition of West Coast states who are
mhm,
saying, we reject this. We
yeah,
reject this like bigoted understanding of the world. We reject the lack of autonomy
mhm,
for women and for trans people that the government is trying to impose. And the thing is, a lot of these things are not yet enshrined in legislation. They're just
Right.
executive orders, which means they're not laws. So the thing
Right.
that's really disturbing is the institutions that are caving in
Yeah.
anticipation, right? And that includes
And
Ivy
like
League
really
institutions, right? Like, fuck those
big
guys.
companies. Yeah. And
Big
people in
companies.
California too.
Right, right, right,
Yeah.
right. But now we get to see in states where protections for trans people, if you want to just look at trans kids, right, or
Yeah.
trans young adults,
Youth. Yeah.
in states where their care is protected by law, explicitly protected by law,
Yeah.
versus places where their care is not explicitly banned, but nobody's really doing it because they're chicken shit. And then in
Yeah.
places where it's explicitly banned. What are the outcomes for those kids? Right? Now, what you can also measure, and your outcomes measures can be, suicide rates, but a lot of those kids, see, here's the problem, is a lot of those trans kids won't say anything now.
Yeah. They're
They'll just
scared.
die. You know what I mean?
Yeah.
Like, if
Yeah.
there's an option for care, I think kids might be more likely to be like, "Hey, this is what I'm gonna do." My own kid didn't, start to transition until she was 19.
Yeah.
So, not that we would have said, "No, you can't do that," but I think
Mhm.
she had just come to a place where she was ready, right? Um, but which means that she was kind of outside a lot of the stuff, right? So I have friends. I have a number of trans friends who didn't start to transition until in their 40s or 50s.
Yeah. Yeah. And so I have a friend who's in her 40s who's she's kind of back and forth a little bit just because it's hard that she's in a weird situation, but when she's feeling good, she'll be her, you know?
Mhm,
And then when she's feeling bad, she'll be more masculine or whatever, or not shave and not wear her wig or not do her makeup or not do her
mhm,
nails or whatever. And then that's like kind of how I know that she's having a hard time, but I don't change her pronouns.
mhm,
Like I still call her her name and use her
mhm.
pronouns.
Right, so the outcomes of interest are actually gonna be harder to measure.
Yeah,
Right?
yeah,
Than if you were in a place where everybody had access and you could look at the differences
right.
between kids who transition or who get puberty blockers or who just socially transition, right? Who feel
Yeah.
accepted. Like, we already know that accepting somebody's identity reduces suicide substantially,
Yeah,
right?
and we also, like, don't have data about, like, the kids who are losing access to gender affirming care because of their age. Like, do they have supportive parents? Or do they have any way to find access to things
Well,
like
I would argue that any kid getting gender affirming support has supportive parents, right?
Yeah,
Because the parents have to engage with the
that's true.
healthcare system
Yeah.
for that.
Yeah, that's true.
Um, so some of the things that we can look at, and again, it's hard because um, there's a few, I think, really interesting cultural things that need to be explored, right?
Yeah.
And so if you ask nurses about their own bias, right? Like, if
Yeah,
you
which is what a
and
lot of the research is.
right. But
Yeah.
I think that's an incomplete answer. I think
Mm.
that this really requires an an investigation of sort of the larger cultural forces in a given
Yeah.
area, right? So, what is the role that religion plays
Mm.
in a community, right?
Yeah.
Where, and I don't mean whether in the way that it supports or suppresses a free expression of gender identity. I'm really talking about, how does what's in your head when you go to work influence whether or not you think that patient deserves to live,
Mhm.
right? And I would argue, I've just finished a study on pain assessment and management, and the distrust that nurses have around patients' pain, reports of pain,
Pain-seeking,
is really
yeah,
astounding.
drug-seeking
It's
behavior.
it's
Yeah.
really astounding, and I would suspect that this also extends to things like gender expression, right? So,
Mhm.
what's in your head when somebody presents to you with a male name on a chart, but looks like a woman and has a woman's name,
Mhm.
right? What happens in your head when that dissonance hits? Do you be like, "Oh, okay," or do you start getting upset about it, right? And if you
Right.
get upset about it, what does that mean in terms of how you view that person's symptoms, whatever they came with, right? Broken
Right. And
leg, cut, whatever,
you're
right?
gonna tone down their, like, emergency
Right,
and be
right,
like,
exactly. Once you dismiss somebody's, right to exist, then my hypothesis would be that you would not treat their pain as well, that you would give them a lower acuity score, that they would not be seen as quickly, regardless of complaint, right?
yeah.
So that's something that I think the importance of understanding how people understand, or why it's even important to them, right?
Mhm.
I think that's the big question that I have is like, who cares? How does this affect you in any way?
Right.
Why are you so upset about this such that you would deny somebody's right to exist?
Or keep talking about it in the nurses' station like they've brought a plague into the hospital.
Yeah. Ooh, be
Like, they'll be
careful, it's
talking.
patching, I'm sure. But that's
Yeah.
the thing. This is the thing, and this is where, I think these, like, bathroom bills and stuff really highlight the fear behind these executive orders and laws and whatever, right? What
Mhm.
that means, especially let's just take a bathroom bill, right? Which North Carolina was gonna have until the NBA was like, "Screw that, we're not," they just pulled all their money out of North
Yeah.
Carolina and then they switched, right? So economic pressures are important, but what it means is that people who are the genital police, for whatever
No,
reason, which,
please. Oh my
like, you
god.
should really, like, do some therapy about that. Um,
Why are you so
anybody
obsessed
who
with people's genitals?
well, it's not that, it's the performance of gender.
Yeah.
Right? So, like, I'm a competitive fencer and I present as female. I am female. I look female.
Mhm.
A lot of my friends as older women don't. They have really
Right.
short hair. Like, they're done, right?
Right.
They have short hair. They look very androgynous. And so, as do most of the teenagers around me, right?
Yeah.
Um, and so it's an excuse to police people's gender performance. It's a way to say you are not female enough, right? You're not female in the way I think you should be female, and therefore you can't call yourself female, or I can
Right.
in some way harass you. Nobody gets
I can't tell, are you a boy or a girl? Are
right.
you a
Why do you
boy or a
care?
girl?
Right.
Yeah.
I don't, what do you care? How does that
Yeah.
impact anything that's happening here? Unless I'm telling you I have belly pain, which is, like, literally the only time you wanna know what's on the inside.
Yeah. Well, the only reason that I would say that if a person is trans, we should do organ inventory is just because if you're a trans male and you've had a hysterectomy, we don't need to do pregnancy tests anymore.
Mhm.
We can just be like, "Okay, you've had a hysterectomy. We don't need to do that." And then it would be already in the chart. However, I've had a hysterectomy and people are like, "Is there any chance you're pregnant?" I'm like, "You've clearly not looked at my chart because I've had a
Right.
hysterectomy." But wonderful, by the way. Not having periods is freaking amazing. So, it's just like I would advocate for organ inventory just to try to get like a you don't have to answer all these questions every time you come in kind of thing. And
Mhm.
especially because so many people that are low income or their insurances don't cover things that they need are going to be coming into the ER. And now people are going to be finding out that if they have Medicare, that maybe they got dropped and they don't have coverage anymore. And so there's going to be more people in the ER using it for primary care, and
Sure.
there's gonna be more progressing illnesses that were preventable that are not being prevented because people can't go to primary care, and they're just utilizing ER
Right,
resources.
absolutely.
Mm,
So the sort of the critically important things to look at from a research perspective are, what's the impact of these of 2 things, right? Like, one is Medicaid cuts, right?
yeah,
And the second is, discriminatory legislation, right?
right, yeah,
The intersection of those 2 things is gonna be devastating for a lot of
and
people,
a
and
company that chooses to, like you said, cave, or a company who like, for instance, Duke put out, like, "We're not ending gender affirming care for trans people." They just put out a thing that said, "We're not doing that. We don't plan on doing that," you know? but, like, the ones that are caving didn't put out anything, and they were kinda just secretly ended their stuff and were like, "Okay, we're not doing this anymore. Shh."
Right.
And
Right.
nobody
Because
knows,
they
like
know that the backlash of, like,
yeah,
you garbage people. But the issue then is why? Why did they cave, right? They're gonna lose funding anyway.
mhm.
Anytime you cave to a bully, all that means is that the bully knows they can come back to you for more.
Right, and, like, where does it end? Because you said we're not gonna do gender-affirming care for anybody under the age of 19, which means that you're legally able to make decisions for yourself for a year
At
before you
18,
can
why
get
are you making it 19?
well, because it was like 18-year-olds can't make decisions for themselves, so maybe, like, 19, but
Why not?
my
18-year-olds
well,
are legal adults.
if you read the stupid Republican dude that put up this bill to begin with, if you read his thing, he didn't cite anything. There's nothing scientific that he cited in there. It's all, what you call it, conjecture, and it's just him talking, and then he was like, "There's a study that says blah, blah, blah," but he doesn't say, like, what study it is,
Oh, then
and,
no,
yeah,
then I
and
don't
then,
believe
like
you. Like, show me.
exactly. Show me the data. It was all this, like, conjecture, and he was talking about how, like, something about brain development and 19, but if you're talking about brain development, you need to go 21, but whatever.
You actually gotta go, like,
And
26,
yeah,
right?
yeah,
For especially for boys, right?
yeah. So then, there was all this, like I said, like, conjecture and stuff like that, and then, the EMTALA laws for, like, sexual assault and like pregnancy and drug use and whatever state that if a child is able to like speak and like decisions and the physician determines that they are like of sound mind, basically they can make decisions for themselves in those settings in emergency departments. So why couldn't a 16-year-old say, my parents are supportive, this is what I want to do, I've been in therapy for a while, like everybody's on the same page, I wanna make this decision, and then you're saying that that 16-year-old isn't able to make that decision, but a 16-year-old could decide that they
It's
wanted to
it's
keep a
just
baby.
inconsistent, and it's a way
Yeah,
to deny people care, right?
yeah, you
So
can decide you don't want an abortion if you were raped when you're 16, but you can't decide to block puberty because you are thinking that you're not that your outward appearance is not how you feel inside,
well,
and
meanwhile, we give puberty blockers to cis het kids who have premature puberty, right? Like, so if
mhm,
a treatment is available to one group of people but not another,
why?
only because of their identity,
Mhm.
that's discriminatory, right?
And
Like,
it's
that's not
we're
good care.
giving men testosterone to make them feel more manly, but you can't give a person who is assigned female at birth testosterone so they can
Right.
live a normal
Right.
life and look in the
None of
mirror and
that
not
makes
hate
scientific
themselves.
sense. None of it
Yeah,
makes clinical sense. This is why we have clinical practice guidelines,
mhm,
the
and we give
WPATH
older women,
stuff,
estrogen to curb, like, menopause symptoms. That's
do
gender
all of
affirming
that.
care. Yeah,
We do all of that, and yet, I mean, look who's running HHS, honestly, like, the whole world has gone insane. So,
insane.
the question then is how do we best bring data to bear to at least be able to say you're wrong, right? Like,
Mhm,
what your policy is incorrect based on the science.
yeah,
Um, so I think really asking questions about patient perception is
mhm.
huge. Um, it's
We talked
and
about
this is
doing, like, Press Ganey surveys
no,
and being like,
Chris Gainey is
"Did"
bullshit. Don't
well,
even,
okay.
like, not
Don't
even,
worry about
right?
okay.
Where I would start with this is not in the emergency department because people will not disclose
Mhm.
necessarily in the emergency departments.
Yeah.
This is not an ED-based survey. This is a
Right.
community-based
Yeah.
survey to say, if
Right.
you go to the emergency department, how do you like to be addressed? Is that your legal name or is that a different name?
Yeah.
And you do it anonymously, right? I think the thing is
Yeah,
when you
and you
approach
just
somebody,
collect, like, demographic data and stuff like that, but
right?
not, like, names or anything like
But
that.
when you approach people directly in an ED and say, would you fill out this survey? They're like, no.
Yeah.
But if they can be part of a more, anonymous, data collection process where you use a link, a confidential link or an anonymous link so that like we just really need to know what's going on in our community and how what we do in the emergency department affects how the community seeks care,
Mhm.
experiences care, follows up with care, right? Like that's actually a really now that I think of it, I would not do that study in the ED. I would do it in the community.
Well, because also when you're in the ED, you're having a problem. Like,
Right. You're stressed out anyway.
you're not focused on, like, filling out surveys. Like, that's why they
Right.
give you a survey after you leave, not while you're there.
Right. Exactly. But
Um,
also the fact that I get a little letter in the mail makes me think, okay, so you knew I was there. People don't
yeah.
like to feel like they're being surveilled either.
Yeah.
Right.
Um, so getting a survey out for people would be like, you know, I guess getting on social media and being like, "I'm conducting a survey,"
Yeah.
like,
After you go to the IRB.
after you go to the IRB, that's what I was gonna ask, is
Yeah.
that
Oh,
you
that's
have to
100% IRB.
okay. And that is just to make sure that well, if you're not collecting anybody's, like, personal data, you still have
Let
to
the
go through the
IRB tell you
IRB?
that.
Okay. I haven't, done that yet, I think that's next semester, but it's a whole thing. Well, I mean, like, I would
Right.
assume that I'd
And
have
also,
to
like,
get
where do you get those people?
yeah, like, is it just, like because it's gonna be, like, people in my community that are filling this out, like, if I put it out on,
Right.
like, my Facebook or something like that, it's gonna be all people that I know and agree with what I am doing, but I want to know, like,
Right. You want
everyone.
something more broad. So
Yeah.
you can just put it out on like general social media. You can do networking, you can do snowballing, you can do what would be an interesting comparison is people in a state like Massachusetts versus people in a state like North Carolina, right?
Mhm.
What are the expectations for respect for pronouns, for disclosure, If you
Well,
don't feel
like you
like
said, it's
anybody's gonna
already worked into your guys's, like, triage and stuff, like, it's part of it already.
more
Like
or less, yeah.
yeah.
They're just that's the expectation, right? Because
Mhm.
we live in a place where people don't always align, and
Mhm.
nobody really cares, right? I just wanna make sure I have
Yeah,
the right person, that's all.
right. When I'm from Washington State, so, like, when I go visit there, I'll see queer people just walking around, living their life
Yeah,
and having a
being
great
queer,
time,
yep,
and it makes me feel so happy to see
mhm,
that, but to be able to see that in North Carolina, you basically have to be at, like, a pride festival,
right,
and to see people confidently walking around and being themselves and being just
right,
extra and fun and totally decked out and whatever, and just being themselves and either wearing full drag or just wearing a swimsuit, basically, like, you just be happy and be yourself and,
right.
feel affirmed and feel just alive, I guess.
Yeah, I mean, I think the burden of having to the burden of fearing, either overt or
Implicit.
covert
Yeah, yeah,
discrimination,
yeah.
it really takes a toll on people, right? Um, and that's part of it as well, right? I mean, you could collect a really interesting amount of data. You could do skip logic in developing a
Mhm.
questionnaire and sort of comparing people who are queer versus people who are cis and kind of what are their demographics, right, at the
Yeah,
moment, right?
yeah,
How many visits to the emergency department do they have? Do they have a primary care? Like, basically,
right.
what is the relationship between legislative and cultural atmosphere and
Mhm.
access to care?
I think it was the Kaiser Family Foundation has something like that. It breaks down, legislature by state and then has some, like, statistics about how that's affecting people. But it would be an interesting thing to do from a nursing perspective, certainly, because it would be like
Sure, because nobody ever studies nurses, so
right, yeah. Like you said before, asking nurses their perception about things like this and then doing training and then asking them how they feel after training is like, you're just gonna like, is that gonna stick? Or, like, are you
Right. Well,
gonna
that's the
have,
thing.
like,
I don't care what
data
you
that
think, I
says
care what you do,
yeah,
right?
exactly.
Because here's the thing, professional ethics doesn't care what you think, right?
No, it
I don't
doesn't matter.
care how you feel about people, right? What I care about is, are you fulfilling your obligation to care for them appropriately in a clinical setting?
Is your personal bias affecting the outcome of the patient? Because you're
Yeah,
saying, like you said, "You don't deserve my care. You don't deserve to live.
right,
So
right,
why would I give you the same care that I would somebody who I agree with or
right.
whose
And people don't
lifestyle
necessarily,
is fine?"
sometimes they think about this very explicitly, but a lot of
Mhm,
times in their head, they're just like, they're being dramatic, they're being, whatever. I'm sure there's nothing really wrong with them. They're just looking for
mhm.
attention.
Yeah, because just being transgender means you're just looking for attention, right?
Right.
Like,
Oh,
people
yeah, sure.
choose
Absolutely.
yeah.
Absolutely.
It's definitely a
Yeah.
choice to decide that you wanna be a different gender and go through all this discrimination, and it's a choice to be gay or lesbian and not fit the societal mold, and, like, if it's a choice, then why don't you be gay? Why don't you try it? You know? Like,
Right. Well,
it's just
how do
it's
you know you're
ridiculous.
straight? Like, when did you know you were
Exactly.
straight? It's very exciting. Right? And
Have you
people,
tried
because
having sex with other genders? Or,
right.
because people will say that to, like, lesbians, "Oh, you just haven't met the right man yet." It's like, yeah, no.
Yep. Sure, because the
That's
assumption
not
is
for me.
everyone is like you, right? And
Mhm.
that's not the case. And that's what makes things interesting.
I was thinking the other day that I really don't like being asked, "What church do you go to?" because I'm an atheist, and I don't go to any church, and in fact, I have not gone to church since I was, like, 16 because it turned into a punishment, um,
Mhm.
basically, and it was my only day to have to myself, and then I was, like, forced to go to church because my parents found out I was smoking weed, and it was like,
Oh, that'll fix it, I'm
"You
sure.
you moved to this tiny little hippie island, what do you expect?" But, so it turned into a punishment, and then I realized that these people are saying one thing in this setting and then being a totally different person in another setting. And I also realized that my perception of anybody who's not a Christian as a bad person was totally incorrect. And I just started realizing that I've been lied to, like, my whole life. And so when people ask me, "What church do you go to?" because they assume that everybody in the South goes to church, that bothers me, but I'm not gonna be all weird about it. I'll just be like, I don't talk about religion at work, or I'll just say I don't go to church and then walk out of the room or whatever. Like,
Mhm.
but people being asked their pronouns will be like, "Why would you ask me that? That's so disrespectful." Blah blah blah. Like, I'm clearly a woman. It's like, okay, well, so is the person over there that was assigned male at birth, but people insist on calling them by whatever was assigned at birth just because they think that's
Right.
better.
So
It's
I
still a
really
woman.
think getting a perspective on people's programming in a way, right? Like,
Yeah.
how are you programmed to see other people? Um, I think for a lot of folks, once you really show them that, they're like, "Oh, I didn't realize I was doing that," right? Like, I
Yeah.
think people are not particularly introspective. I don't think they do a lot of metacognition, and
Well, because it's all
uh,
task oriented, a lot of it, like, you're
exactly.
just kind of doing your job, and
Right. Well, if you're
you're
just doing
doing
your
your
job,
12
then just do your
hours.
job,
Yeah.
right? Don't get upset about who's in front of you. Like, we all take care of people that we're like kind of like,
Yeah, I
wonder when
wonder
that
what's going
happened.
on with them. Yeah.
How about that? Right? But I
Um,
think the really important thing is that, a lot of nurses have no idea that of their ethical obligations. They have no idea that there's a code of ethics that they are held to in a very real and legally binding sense. If
that's
you don't
why
if you
in
behave unethically on the job, they will take your license.
well, not if it's not reported and not if it's just kind of acceptable. So, like, I have I have a, like, document of things that I've witnessed at work since I said, "Hey, we need to address not, affirming people's genders in triage." And then they kind of were like, "Oh, the company's not gonna pay for, like, that education or whatever." And I was like, "Well, so you're saying you don't care?" And they're like, "No, nobody said that. We're very supportive, blah, blah, blah." I was like, "Okay." So I started documenting everything that I reported to my managers, but as a resource nurse, my manager was like, "All I can do is send it to the manager of that department, and then kind of, I can't change anything. I can't make them
Mhm.
address this with the person, So I started documenting, like, one was there was a trans woman. This was before we were allowed to change their names. This is the reason why we got to change their names, is because of this incident. But there was a woman who came in, and her name was whatever her birth name was, and I go out and I'm looking at this male name on the chart, and I'm looking at a woman, and then I say the last name, and she gets up. I get her in the triage room, and I was like, "What's your name?" And she told me her birth name. I said, "No, no, no, like, what do you want me to call you?" And then she was like, "Well, I'm trans, and this is my name." And I was like, "And your pronouns are she, her?" And she said, "Yes." And then I was like, "How many times have you been at this hospital? Is this your first time at this hospital?" And she was like, "No, I've been here several times and nobody's ever asked me that." So then I realized that I didn't have access to change it, and it doesn't print out on the wristband when you do change it. So I went to registration and I said, "Hey, can you change this person's name?" And they're like, "No, I can't do that." And I'm like, "Yes, you can." And and they were like, "No, but you can't, like, so if you need to change somebody's legal name, you can't do it until after they're discharged." So people are like, I'll say change their name, and they think I mean their legal name. And I'm like, "No, like, it'll say preferred name. It should say chosen name, but it says preferred name." And you just put it in there, and then it comes up in quotation marks. And they were like, "I don't think I'm allowed to do that." And I said, "If you don't think you're allowed to do that, then you need to tell whoever tells you that you can't do that to come to me, and I'll bring them to HR." And and they were just like, "Oh, well, I don't wanna get in trouble." And I was like, "I'm gonna be your trouble if you don't change this person's name," you
Would you
know?
get in trouble for adding an allergy to the chart? No, because it improves patient care.
Mhm.
Why would you not be able to
Yeah,
identify your patient properly?
right. Like, yes, I do need to know their legal name, but I can see that in the chart when you bring them. I don't need to know their legal name to start, like, taking their vitals or whatever. You tell
Right.
me what they wanna be called, I affirm their identity, I get their blood pressure. Like,
Right.
it's just.
But the thing is here, right? So all of this conversation really centers around this idea that harm is being caused,
Mhm.
right? What you have is an institution that is resistant to recognizing harm because they're not being sued, they're not being whatever, or it's a small enough number of patients that they just don't care, right?
Yeah, it's like 6
So,
or 7 over the course of, like, a year that I've personally witnessed.
right.
Not things that I've been told about, which are, like, a whole number of other
More
things.
numerous, right. But the
Yeah,
question then is harm only caused if the institution gets, like, sued over it?
seems like it.
Or do you have a commitment as an institution to care for all patients? Because if you do, then these are some very concrete things that you can do.
Mhm.
And from a research perspective, trying to quantify what that harm looks like, I think is best researched outside the hospital setting and in the
Yeah.
community because that's where you find out that people go to other hospitals, right?
Mhm.
Or they delay their care or they try to
Mhm.
figure stuff out at home, right? Which
Yeah.
eventually becomes kind of a hit for a
Yeah.
healthcare system if nobody wants to go there, right?
Yeah.
Or if their dollars are going to other institutions, right?
Mhm.
So the issue of what is the relationship between kind of disrespect and harm in a clinical sense, right? Because it's not um it's not as measurable in
Yeah.
other ways, right?
Yeah.
So sometimes you just have to go for the jugular and look at financial outcomes. Basically it's a follow the money problem,
Yeah,
and
because
it
that's what they keep
sounds like
focusing back on. They're like, "We're gonna lose our Medicare funding," and all
but you're
this
going to
kind of
lose your
stuff.
Medicare funding anyway.
Mhm.
The trans people don't matter in that calculation, like, don't
Yeah.
be an asshole.
My my thing that I find most unethical about this is that there was an article boasting about how much profit that they made last year,
Mhm.
and then to tell me that they have to be really careful to keep the Medicare funding so they can take care of all patients, and this
Right.
little group of patients, like, is
Except those patients, right? We
able to
don't care
go by
about
the
those.
wayside because
Right.
they're not the majority,
Right.
and,
Well, what happens when so this is sort of a thing that happened with USA Fencing as well,
mhm,
where they, in compliance with the executive order, which is not a law,
mhm,
the NCAA decided that they would not allow transgender athletes to compete, and therefore the national governing body for the sport has to go along with that, or we're out of the
mhm,
Olympic pipeline. It no longer is an Olympic sport. Um, but our point to to them was, why did you do this? It's really about the IOC, right? And
yeah,
so for hospitals and institutions, for whatever reason, they are complying with something that is not law to
mhm,
avoid an outcome which is coming anyway.
yeah.
Um, and
Also could
so
be mitigated by proper education,
well,
like,
it's
in
not
some
even that,
ways.
because you can't educate people to care about other people, right? Like,
I guess
we as
that's true.
educator people like to think if we just explained it correctly,
Yeah,
people would understand and then be
yeah.
better, and that's not the case, which is why, honest to God, I think you need to, like, sit down with some good Christian ladies and find out what their problem is.
Yes, what's your
Like, seriously.
like, what well, it's against the Bible is what they're gonna say,
No,
and, like,
it's not.
where
There's
yeah.
nothing about it in the Bible anywhere.
Yeah. Yeah, my thing is, like, when so if I go to, like, a pride festival or whatever, most of the time they have protesters. It's, like, a group of, like, 4 dudes holding a sign that says, like, "God hates faggots," or something like that, you know? And but the phrase "God hates" is those 2 words should be mutually exclusive because
Mhm.
God, the entity described in the Bible and worshipped and whatever, is not capable of hate.
Well,
Like,
that's
that's
not
not a
true, because your
thing.
Old Testament God hates everybody.
But if you're a Christian, the Old Testament God is
Exactly, so
is
stop citing Leviticus, which is
yeah,
Old
because
Testament.
Leviticus
Stop it.
isn't even something are we
Right,
still
again,
sacrificing goats? No. So, like,
it's
those laws don't matter
theologically
anymore.
inconsistent, it's like, it is completely cherry picked, right? So,
Yeah,
basically, you're dealing with people for whom education is not the answer,
yeah,
right?
yeah,
So, the so what's more important, I think, are 2 things. One is that you have to have an institution that holds people to a standard of
mhm,
behavior, right?
yeah,
I don't care what you think. This is what we're doing,
right,
right? That's one thing, because intent is unimportant
yeah,
in this case. It is outcome. So you need an institution that uh, actually cares enough about all of its patients to require that all personnel treat patients with respect,
yeah.
right? Education doesn't fix that,
No, that's true.
right?
I would hope that, like, my idea for the education was to have queer and like patients that are trans or non-binary speak about their experiences in front of this group and kind of like tug at their heartstrings. But like you said, I mean, like if they're already set in their ways, that's just going to be like acting
Right. That's just
almost.
exposing people to more discrimination.
Yeah. Well, and that's kind of the thing is I was talking to somebody about it and I was like, it would have to be somebody who was in a comfortable space and not having any mental health issues or whatever, because they're gonna get questions. And I would hope they're like good faith questions. But a lot of people are really ignorant about queer people in general. And so they're gonna have weird questions. And and some of them are gonna make people feel like really uncomfortable because like you said, who cares?
Right. Well, the
Who
other
cares
thing is, like,
what my
this
genitalia is or what
idea
I
of
wanna
"I
do
don't
with it.
know any queer people"
Yeah.
is ridiculous.
Yeah, they're
You just
everywhere.
they're everywhere,
They're everywhere.
right?
And, and, like, you have your, like, straight appearing, like, bi couples, like, I'm married to a cisgendered guy, I'm a cisgendered woman, but I'm bisexual.
Mhm.
So, I mean, like but just because I'm married to a guy doesn't make me any less queer.
So education, like, ignorance is not the problem here,
Yeah.
right? So
Well,
What
that's what I was
actually?
told by the DEI when it was DEI, was that they even said in this email that I have, saved and whatever, it says, "Education's not the problem, it's that nurses are uncomfortable asking people their pronouns." And
Yeah,
I countered that, like, so we can ask them when their last bowel movement is, or really personal questions. Like, "Why'd you put that
sure,
in
but
your butt?"
educating
Like,
nurses
stuff
as
like
to
that.
why pronouns are important is not
Yeah.
going to make them any less
No.
comfortable if they're already you've gotta go upstream.
Yeah, you gotta say, like, "This is our policy, you treat people with respect, if they give you a name, that's what you call them, if they give you pronouns, that's what you call them, and if you don't, there will be repercussions."
Right,
And
the
that's the
end.
thing, is that they're like, "Oh, we provide the same blah, blah, blah for all," and that kinda stuff, but there's no, like I said, I've reported, like, 6 or 7 things, and, like, absolutely nothing was done about it. Absolutely nothing. But there's a zero tolerance discrimination policy in place that's not being enacted.
Right. Do you know why? Have you I don't know, we did a paper on bullying and
Yeah.
bias. Well, I've done
Mhm.
two papers, one on bullying, one on bias, but, like, the bottom line is that nobody wants to get involved.
Mhm.
They don't care.
Because you might lose your job, or you're gonna be, like, viewed as a problem. They're like, you get scrutinized, like,
Sure, of
really,
course.
really closely if you start poking at things that they don't wanna be poked at.
So,
So,
you have a lawyer because that's
yes, I
coming.
do. Yeah, yeah.
But, but again, this is not a problem that education fixes.
No, and that I hate that, because, that's your, like,
Yeah.
go-to,
That's
is, like,
that's what smart people do. They learn more and then they do better.
yeah, and that's my thing, is, like, oh, so many nurses are like, "I don't have the time to do this extra education," or, "I'm only doing the bare minimum to do my job." Like, why don't you, as a nurse, want to learn as much as possible? When I was introduced to conferences, I fell in love.
Mhm.
And I was
Same.
like, "This is amazing, I'm learning so much," you know? And then it's so exciting when you read a paper and then you realize that somebody's gonna be talking about that paper at a conference. So, like, for instance, your paper on, "What if it were me?"
Yeah.
Um, that I read that, and I was really, really pissed off about, about, like, women's rights, and that's what I was focusing on in my BSN. It was either women's rights um, trans rights. Um or mental health, or, they're all kinda tied in with mental health,
Mhm.
but, like, yeah, I read that and I was like, "Yes, exactly. What if it was you? Like, are you gonna report somebody for making a decision about themselves because it's their body, and it's not your place? It's a HIPAA violation, like, you can't do that.
Right.
It's not child abuse to have a miscarriage and flush it down the toilet. It's not."
Not child abuse to get the best care for your child that you can, that they need,
Yeah,
right?
yeah.
So,
And it's not child abuse to decide that you're not in the right place to have a baby, and that
right.
you're not gonna be the right person to have a baby. Like, and then people are like, "Oh, put it up for adoption and somebody will take it." Okay,
Yeah.
how
Adoption's an alternative to parenting, not pregnancy.
right, but, like, you think about the psychological and physical changes that pregnancy puts on your body.
Well, there's a lot of trauma around adoption that's pretty well documented in the
Yeah.
literature, but I wanna go back to this idea of, you know, n I would say that a big piece of all of this is the, Christian nationalism that's
Mhm.
starting to really become very explicit, both in legislation and in
What
more
happened to
civil like,
separation of
civil
church and
society.
state?
What's
Does
that?
that go on? I said, "What happened to separation of church and state?
Yeah,
Does
well,
that
that's the
go
thing,
on?"
right? So you have people right now in charge of the government who don't believe that,
Yeah.
right? And you've got a Supreme Court that apparently doesn't believe that either. So where a lot of this is coming, especially in a place like North Carolina, where the evangelical population, once you're outside the research triangle, is pretty significant, right?
Mhm.
Um, and they are the people driving a lot of this legislation. It's templated. This is templated legislation that has come from. You think Donald Trump gives a shit about transgender people? No, this is Russell Vaught whispering in his ear. This is Stephen Miller whispering in his ear, right? These are all these other people who are trying to create, right? And this is part of a way that we create the expectation of what women should look like, act like, and behave like. And
Well, listening to them talk about, like, how their wives should act and stuff like that, and, like, Vance talking about his wife being, like he's kinda like, "She's smart for a girl," kinda thing, like, the way he talks about his wife, and I am the the breadwinner. I go to work, and I make all the money, and my husband stays home and takes care of the house and the cats. If somebody tells me that, like, my place is to do what my husband tells me, like, that is mm-mm.
sure,
I yeah.
and and in
No, no.
and where I'm from, that's totally normal, right?
Yeah,
But what happens when the government decides that women shouldn't work?
yeah, then I guess we're gonna be homeless.
Right? What then we're all gonna starve, right?
Yeah,
What happens when the government decides that, Black people can't hold certain kinds of jobs, right? Because and people think like, "Oh, they can't possibly do that." Well, they're doing that, like,
they're
when you
saying
the
that
minute you
DEI
float
is discriminatory against white men
right. Well,
because
once
yeah,
you start floating the idea that the Second Amendment, right, the sacrosanct Second Amendment, no longer applies to transgender people,
mm,
right? Then you can just cherry pick and you can say, well, the First Amendment applies to everybody except this group of people,
yeah,
and the Fourth Amendment applies only to this group of people, right? So what is happening here is the Overton window is moving in such a way that trans people and the way that we treat trans people are the canary in the coal mine,
yeah,
right?
they're
And
the
so
focus right
this
now
is
for whatever reason.
right. So this is
Yeah,
the group that's in the
yeah,
crosshairs right now
yeah,
because they're a small minority, they're a vulnerable minority, and but it's the trial run,
mhm,
right? For the next group of people,
yeah,
and the next group of people, and the next group of people. And so to me, as a nurse, I feel it's incredibly important to push back on any dismissal or discrimination against
yeah,
any
and
group of
my
people.
point
It's very surprising to me that nursing as a discipline, but it's not surprising, right? Because
yeah,
nursing as a discipline is very white, female, hegemonic, non-confrontational, all of those things, right? So all the things that nursing is really not what nursing could be and what nursing needs to be right now as a force for advocacy,
yeah. We're supposed to be advocates, that's part of our freaking job. Like, it's in
but
the
not
code of
like that.
ethics. Well, yeah, but only in the way that they, like, want us to. Like, we
Right,
have to
exactly.
advocate for, like
Right. Because again, it's a bunch of women. It's a right? It's a
yeah.
female heavy thing. And so when nurses get angry about things, we're just like complaining.
Yeah, and I'm aggressive.
Right. Oh,
So,
me too. Me too.
yeah.
And
I'm
rude.
aggressive and, confrontational, and I need to know how to talk to people in, like, leadership, and I have to be super professional when I speak to people in leadership, and don't challenge them, but just voice your concerns, but not in a challenging way,
Right.
and
Yeah,
blah,
yeah,
blah,
yeah. I
blah.
get that all the time. And I'm like, if you're
Yeah.
being an idiot, I'm gonna tell you you're being an idiot, right?
Yeah,
So like maybe
I mean,
don't
I'm
be an
not
idiot.
gonna yeah, stop that,
Yeah.
like, they're like, "Don't you can't be the only one asking people their pronouns." I'm like, "Okay, then make everybody do it." "Well, we can't do that because everything in healthcare takes a long time to change." "Okay, fricking start then."
No, it doesn't because I would offer like when we change an EKG protocol, that changes
Oh,
overnight.
overnight, yeah, and, like, if you're like we have to use SteriPass when we're collecting blood cultures now, and so they're rolled out on the floor, and then there's somebody that goes around and does the education with them, like, make sure you know when to press the button and when you blah, blah, blah.
Right. So
So, like
procedural things can change overnight and do and should.
yeah, yeah, it's
Right.
just you can change those things so quickly, but
Right.
something that you overcomplicate it to the point where you're saying it's not worth it,
Right.
and but it it is, and,
Sure, this
like
is where bureaucracy can this is where you when if you're using bureaucracy for good, then you can stymie, you throw sand in the gears of fascism. You can also throw sand in the gears of progression,
mhm,
right? Which is what's happening here.
yeah.
So,
These these sessions, like, while I'm going through this, like, these are these are just, like therapy for me to like talk through my to talk through my like trauma of being like yelling at this brick wall that like won't move and be like,
Right.
why are you doing this? This is
Right.
against everything I stand for.
So
And
this is
then
where you go to a conference
yeah,
and you find people and
which
you
I
all
have
plot together.
yeah. Yeah, so, we'll be in our cute little masquerade outfits or whatever and talk about, like, dismantling the patriarchy.
100%.
Yeah,
100%.
I'm super down for that.
Yeah.
Um, so how do nurses get involved with research without getting a master's in clinical research like I'm doing? Where do you like, what can you do from if you're a bedside nurse and you just wanna help? Like, how do
Right.
you get involved in that way?
There's a couple of ways. It depends on where you are, right?
Mhm.
Because clearly you're having some trouble doing that, right? So
Yeah.
if you are for bedside nurse and you're really interested in problem solving, like
Mm.
clinical problem solving,
Yeah,
right? And your hospital has a research council or
yeah.
research or scientist, you go to them, right?
Mhm.
Start there. If you're looking at problems more like the ones you're describing, which may or may not get a good reception,
Yeah,
um, in the institution, I think it's worthwhile to reach out to your local, not even, we got Zoom, who's doing research in the area,
yeah,
right? And the way you find that out is you do, like Google Scholar is the easiest way to
yeah,
find out anything, right?
yeah,
So instead of just typing in Google, you type in Google Scholar, right?
yeah,
Which
yeah,
gives
yeah.
you all the peer reviewed
Yeah, and
literature.
then you can change it by date and
Right. But
location.
what you want to look at is who's writing
Mhm.
in this space, right? So let's say you're looking on decision making around reproductive care and emergency departments, and you pull up
Yeah,
our paper and
yeah,
you find Lisa Wolf, and you find Lisa Wolf is either at ENA or is at the University of Massachusetts. The contact information is there. Actually, I did that study through UMass.
yeah,
So you reach out to that researcher and you say, "Hey, listen, I read you." The best thing you can say to any researcher is, "Hey, I read your paper." They'll be like,
yeah,
"We're friends now.
yeah,
Whatever you
yeah.
need."
Well, so
Right?
Brian Martinez has a, and I can't remember the other person that wrote it with him, but, he wrote the newest, like, transgender care education thing for the
Mhm.
emergency department, for the Journal of Emergency Nursing,
Oh,
and
Justin
it was
Malici, maybe. Yeah.
what?
Justin Malici, was that the other?
Ye I read his paper too, but,
Yeah, he writes on that a bit.
yeah, he's from Boston too, isn't he?
He's actually in Texas, but
Oh,
he's
he's
from
Jesus.
out by me, so
Yeah, there was, like, something he was writing, when he was in, like, a residency program or something
Mhm,
like that, where he was, like, a student, assistant professor or something like that.
mhm.
That's where I saw, like, his profile, but
Oh,
he's on my
interesting.
list of
Okay.
people to contact, but, Brian Martinez wrote a paper that was, like, I kid you not, it was exactly the thing that I wanted to do in my ER, and I was like, "You did the thing before I did," and then I was like, "But that's good because
Right,
that's
because now
precedent."
you have evidence
Yeah,
that that thing works.
yeah, and so I reached out to him and I was like, "What do I do? Like, I'm having
Right.
such trouble," and he was the one that suggested that I start just kind of getting buy-in from people that I already knew supported it
Mhm.
and just kind of grow community and start doing, like, community resources and things like that. So I did, like, tips and tricks for, like, asking people their pronouns in triage, which was basically to slip it in with other quick-fire questions,
Mhm.
so you don't have time to argue if you're just asking it of a cisgendered person just to say, like, "I'm asking everybody." And then because people get upset about the suicide screening questions and the domestic violence screening
Oh,
questions
yeah,
all
I
the
always
time.
say we ask everybody this.
Yeah, and exactly. If you say like, "These are questions we ask everybody, I'm just gonna go through them really quick and just, answer honestly and we'll move on." And then if they get, "Why are you asking me that?" That's something that we're asking everybody to
Ask everybody.
ensure
Right.
safety and equality of care. And
And I
then
just wanna make sure I'm addressing you by the right name. That's
yeah,
all.
it's like, I just wanna call you what you wanna be called. I wanna respect you.
Right.
And, I also had education things on there where it was like, if you want more education about this, go to GLMA or, the LGBT Research Foundation or something like that. Queer CMEs is a website that you can just go on and get, like, learning about LGBT people and stuff like that. So I made one, like, for providers and one for nurses, and, like, the ENA obviously the ENA University has, like,
Yep. Has some
care for
stuff.
that. Yeah. So that was on there too, and then so, like, those are, like, little badge buddies that I can just be like I make like the, like cute little badge reels with like resin things or whatever, or I put buttons on them and then I just give them to people and people are like, people love badge reels. Like nurses are crazy about badge reels, right? So you give
Right.
them a badge reel and then you're like, here's these little things. And then they kind of like look at it all weird. And then, but it's like you're putting it to them and being like, look at this, like
Right.
think
Here's
about
the
it,
thing.
you know?
Right. So here's the thing. When you intervene in some way, right?
Yeah.
Um, you want to, like, in the same way you put oxygen on a patient. What did that do? Right?
Yeah.
When
Improve
you give out
their,
this
yeah.
information to people, like, what's the outcome? Because when they come to you and say, why are you doing this? To make myself feel better is not the answer, right?
No.
I'm trying to
Yeah.
provide better patient care. How do you know you provided better patient care?
Because they tell
Right?
me.
That's what?
Like, because they tell me, like, because they're like, "Thank you so much." Like, and
But
and they're like, "Thank you for having that on your badge so I know I can trust you."
right,
And
that's
it's like,
100%. But then how do you extend that to the rest of the group? Right?
I
How do
give
you say
mentions.
to a um how do you say to an organization, this is helpful, patients appreciate it, right?
Asking people from the community that have been to the
Ask
ER.
the people. Right,
Yeah,
exactly.
yeah, but not in the ER because 'cause they're focused on other things.
Because they're focused on not letting you do it.
Mhm. Yeah. Yep. Yeah, and that was kind of Brian's, suggestion was, like, get your community involved and get a backing, and it's a lot. It's a lot of work.
It is a lot of work, right? That's
Yeah.
why it's a job
Yeah,
and
well,
not a
I would
hobby.
like to
You know
get
what I'm
hired
saying?
for that so I could do it for a job instead of doing it in all my free time.
Right, that's why you get a degree and you go start doing it.
I'm working on it. I graduate in May.
Yeah,
But, yeah, I was thinking about doing something with, like, a research grant and kind of, like, but it would still kind of be on my own time because even if I got a job, like, I interviewed for a job as a research nurse, and it was very much like, you are conducting the research that is
right,
given
it's a
to you.
clinical
Yeah,
research.
and
Yeah.
so I need to figure out how to do what I need to do, and that's kind of hard because I will what?
Need a PhD.
Yeah, so that's the next thing. And I'll just keep going back to school and never pay my student loans that are, like,
Pretty
growing
much.
and growing and
Why
growing.
not?
As long
Just
as they're
stay in
gonna
school
give me
till
the
you're
money.
ready to die. What?
Yeah, as long as they're gonna give me the money to do the education, I'm gonna take it.
Sure.
And yeah,
Just keep going.
yeah. So, the plan after my master's is to take 6 months off to chill for a second and then go for my
Yeah, then do a
PhD in
PhD at
nursing
UMass.
research. Yeah, yeah. 'Cause how long would the program be after having an MSN?
Any if you have a master's, any PhD program is 2 years of classes, and then however long it takes you to write your dissertation.
Yeah, well, I mean, like, I feel like my dissertation's practically done already because I've been writing it
No,
for.
it's not. No, it's not, and here's why. If you come out of a PhD program with the same question you went in with, you got no benefit from that program.
Oh, interesting. Okay.
Yes.
So reframe the question to
Yeah,
get
the
a
question
better
gets bigger, it
response?
gets smaller, it changes, all the
Yeah,
things happen,
yeah.
right? The
Interesting.
problem is both bigger and smaller than you think it is.
Yeah.
So,
Yeah, because the problem, so, like, it is morphed over the course of, like, my my just kind of going down this rabbit hole of, like, I need to change nursing, basically,
mhm.
and so it started with, like, mental health, like, behavioral health patients being stuck in
Right,
the
but the
ER for
place
a
you
long
start to
time.
change nursing is in the academy. It
Yeah,
is where we are teaching
yeah,
pre-licensure students. That's
yeah.
where you change nursing.
And that's kind of what my thought process was like, okay, so if you're if you are educating nurses when they're in the education mode, when they're in school, and say this is the expectation for
This is
nurses
what
when you
nursing
get into
is.
the
This is
field.
what we
Yeah.
do.
Yeah. And so, like, I was taught in nursing school that we treat everybody the same and give them the same care. If you're taking care of your grandma and then you're taking care of a prison inmate, they should be getting the same quality of care. You should be giving the same concern to their complaints, and if they have an issue that you would bring to a doctor, you need to bring that to a doctor regardless of, it's your grandma or it's a prison inmate.
Right.
And And so like those kinds of things were brought up, but they didn't talk about the LGBTQ community in nursing school, I don't feel like.
Where did you go to
And
nursing school?
CPC, I went here in North Carolina.
Oh,
So, yeah, exactly. But, but then they did change the TNCC to have special populations, like the transgender population as a special population, because you can have surgery on like your Adam's apple to like shave it down, and that'll make you a difficult intubation likely.
uh-huh.
And like binders and different like things that you can have going on, and just the possibility of pregnancy with trans males, like those kinds of things
Mhm.
are special considerations, but they don't talk about the special consideration of you're going to affect your patient's care negatively by not respecting their identity. And that comes back again to education's not the problem.
Right, exactly.
So,
Alright, what else do you wanna know?
how to take the system down?
Well, that just requires, persistence,
Yeah.
right? But
Yeah.
education, like the idea that education or information changes people,
Mhm.
not as solid an idea as we all kind of like who have been changed by education,
Mhm.
like to think it is.
Yeah, my thing, like they said that the uh the voluntary education was like sufficient to help nurses learn how to better care for the LGBT
Right? Show
population.
me. Show me
Yeah,
the outcomes.
exactly. But I was like, okay, but if the people that are going to the voluntary education are not the people that need the education, they're the people that
Right, it's a
support it and say,
self-selecting group.
exactly. So, yeah, so we've covered basically how to get into research, how research informs better care, and how to reframe questions so they can get a response
Right,
from people who are refusing to see it.
right.
So I'm gonna close us out, and then I'll let you go and enjoy the rest of your day. All right.
Cool.
And that's what she said. Have any titillating topics for the future? Still have burning questions from today's discussion? Feeling frisky and now you want some action? Slide into my inbox at smutdidyousay69@gmail.com to find out how you can get in on this. And follow Queerlina for a link to education and resources related to today's topic and updates about our next show. Good night, my little smut heads. And thank you, Dr. Wool.
Hey, no problem.
Thank you for listening to Smut Did You Say? You can find links and resources mentioned in this episode in the description below. For a downloadable PDF of Nikki's resource handout, along with additional emergent support options for queer individuals, visit queerlina.org/helplines. That's QUEEROLINA.org/HELPLINES. Take care of yourselves and each other, and we'll see you next time.